Hi, I'm Dr. Fazir Omar. I am a consultant cardiologist with interest in interventional cardiology. Spent quite a long time in UK, so graduated in Manchester in 2002. And then further on, I've worked in various parts of UK, down to London, and finally in 2007, decided to come back to Malaysia to serve the country. In 2013, I was in Washington DC to do an interventional cardiology research fellow post. Came back to IGN and then finally decided in 2018 for a change of air, left IGN and now I'm in Cvskl. So I think that cardiology combines a very nice niche in medicine where there's a lot of research in cardiology. There's also a lot of things that we can do to help patients. So it's very nice to be able to treat them and see them go home safely. So one of my patients recently mentioned to me that he could not believe that everything that we did from his heart is just from this small puncture of his wrist. Well, he commented like, oh, you guys are like artists because you can actually do a lot just from something so far away. So that was nice. So our bread and butter is interventional cardiology, is putting stents to open up blockages. When things are very calcified, and that's where we have challenges in cardiology, because we want to put a balloon or a stent to allow better blood flow. We have new devices like IVL, intravascular lithotripsy, in which the ultrasound waves is able to open up the calcium, to break the calcium so that we can implant a stent. The other interesting aspect of interventional cardiology is the valve. Like TAVI is a way that you can repair your valve not by open heart surgery anymore, but through your leg and through your groin. So the TAVI is your aortic valve, and we also have the mitral valve. So that's another aspect that we have been involved, in which you can have a leaky valve and symptoms. They normally complain that they have shortness of breath, swelling of the legs. So all of this valve is usually done by heart surgery. Cvskl is very unique in the sense that the heart team meeting allows us, from the cardiologists to the cardiothoracic surgeons to the anesthesiologists, where we can discuss patient care. Because the field of cardiology is it's emerging between cardiologists and cardiothoracic surgeons, that it's very important for patients' care and patient safety and care. What is the best decision for the patient? So it allows us to discuss what's best for the next step for patient care. So that's very unique here in that sense that we have a very good relationship between the cardiologists and the cardiothoracic surgeons. So a typical day for a cardiology is, so we wake up very early, no choice. We have to do our rounds. So normally we are at work before 8 o'clock, we do our rounds, see the patients. I normally start about 8 o'clock in the morning, and it depends how many cases. So once the cases are done and patients are well and safe, then start my clinic. And after that, we'll do our rounds again to see our patients, make sure that they are okay. And after that, we have meetings. So I've been involved in webinars every Saturday, so we have to prepare for talks. If I do have some time, I love cycling a lot. There are times where I have to wake up like before 6 o'clock in the morning to cycle, or I cycle at 10 o'clock at night. We sometimes take time off to cycle around Malaysia. So we've been to various parts of the country, even from KL to Langkawi to Johor. We've been cycling in Sabah. Cycling is my downtime, but during this MCO time, I only cycle very early in the morning or at night when I have the time. So my advice is that please look after yourself, because you'll be surprised sometimes that we think we are all healthy and we're all young. Or we all think we are young and we all think we're healthy. So sometimes or all the time you should try and remain a healthy lifestyle. And not only that there are also times that you do need to have your checkup as well. All of us, including doctors, to make sure that we can continue having a good lifestyle.